Hello, I would like to give you a brief overview of the alter senses, ear, eye, and nose. I wanted to touch on things realistically for the nurse. I know that this PowerPoint came straight from the book and it talked about the anatomy, which is very good to know. But I'm going to touch on more of things that you need to know at the bedside as a registered nurse. So most of this will be more of audio, so you can listen to me as you drive. Please try and learn your terms because I will be going over them again with our mobile devices as we did in class before. Here are some terms. Look at myopia, hyperopia, presbyopia, astigmatism, diplopia, photophobia. Here are more terms related to the pupil function. Cataracts. This is the Snelling chart. Use a lot in ER. I will speak to you more later on glaucoma, but know that the increase in intraocular pressure, know the normal pressure. This is how the physicians test for intraocular pressure using a tonal pen, and there's like a little rubber device that goes on the outside of it. Not used every day in the med-surg practice at all. Don't forget this. I will talk to you some more regarding retinal detachment. And I will talk to you a little bit more about the ear. Oh, our very famous epistaxis, or nosebleed. I'll talk to you more about that. And this. This is a nasal packing, as some people call it a nasal tampon. The doctor inserts this portion, the white portion, in the mouth. At the very tip, a syringe goes into there, and it pushes about 10 ml of normal saline or sterile water, and this portion gets saturated and it expands to hold pressure against the points that are bleeding inside of the nose. I will speak to you more about Meniere's disease and things we should know as nurses. Sinus problem seems to be very common, so please pay attention to this slide. Most physicians complete this assessment skill, transillumination. The remaining of this lecture will be verbal and it will remain on this slide. So first I would like for you to turn to chapter 46 and let's get started with the assessment of the eye and the vision. I just want to talk to you about this very important factors, and keep in mind I am just going to, from this time forward, point out some very important things that you need to know. Now when we're teaching clients about eye health, for yourself and for me also, we should be teaching patients about protecting our eyes from the ultraviolet exposure by wearing sunglasses when outdoors, when they're tanning in the salons also, even when they're working with UV lights, you should be wearing sunglasses. I know there are a lot of terms, but I want you to this is just basically remembering what exophthalmos, that's EXOPHTHALMOS, that means bulging eyes. And then when you see the person with drooping eyelids, that's called ptosis, okay? But if they're sunken in eyes, that's called enophthalmos, ENOPHTHALMOS. Please be able to recognize and be able to diagnose, not diagnose, but be able to know the term for if you see a person's eyelids, not their eyelids, but their pupil sizes. When you see that their pupil sizes are just really different in size, that's called aniscoria, ANISOCORIA. I know in chapter 46 it doesn't talk about it much, but understand what corneal staining is. I deal with this a lot in the emergency room when the patients come in and they have some type of trauma in their eye. I know that we have to get ready for corneal staining. It's a little strip that we use, and we put it at the bedside for the doctor, and the doctor actually puts that strip inside of the patient's eye, which after seconds it starts turning like a bluish color, and then they look under fluorescent light to see if the patient has corneal staining. So basically our job is as a registered nurse is to set the patient up with the fluorescent strips. Fluorescein strip, not fluorescence. Now I know back in 212 we talked about eye drops, so I wanted to reinforce, since this chapter is on the eyes. Now when we put our eye drops in the patient's eye, we hold pressure against the corner of the eye nearest to the nose after instilling the eye drops. But do you know why you're doing that? Okay, so that technique that you're doing is called punctal, P-U-N-C-T-A-L, and basically you're doing a punctal occlusion, whereas it prevents eye drops from being absorbed systemically. So that's why you're holding that pressure, because you're preventing systemic absorption. Remember, when your eye drops, if you get one eye drop contaminated, you put eye drops in 2 different eyes and they become contaminated, don't take the chance. You have to get rid of those bottles and just get another one. Don't clean the bottle going, oh, it's okay. No, you can't do that. You have to go get a brand new bottle. Now in your book in chapter 46, it does have a picture with colors, different colors in it. And in those colors, you can actually see the number 5. So that's called an Ishihara chart, I-S-H-I-H-A-R chart, which is used for assessing color vision. Please remember these facts. So every student should know these facts about the eye. Okay, so the inflow and outflow of aqueous humor control the intraocular pressure. Glaucoma results when the pressure is chronically high. Muscles of the iris relax and restrict to control the amount of light entering the eye. Rods work in low light conditions. Cones work in bright light conditions. I wanted to reinforce that you know the cranial nerves for the eye, like you know that the cranial nerves controls, cranial nerve 2, 3, 4 controls the eye function, right? And then the cranial nerves involved with eye function, all of them, the ones are 2, 3, 4, 5, 6, and 7. With every lecture, we have to talk about the changes that happens with the older adult. So normal age-related changes include decreased eye muscle tone, development of arcus senilis, that's S-E-N-I-L-I-S, and decrease in general color perception. And then the last one is increase in point of near vision. When the book talks about corneal ulcer, most patients who have a corneal ulcer needs antibiotics every 24 hours. And it's every hour for 24 hours. So we have to critically think when we do our assessments. If these patients are on sleep medications going to make them drowsy, things as such, there's no way, or could possibly, I won't say no way, but these patients are going to have difficulty waking up every hour to give their medication. So they might need a little help at home that first 24 hours when they get home. Someone that's able to wake them up every hour so they can put their eye drops in. And those eye drops will be antibiotic eye drops. Don't forget about psychosocial when we're talking about our older adult and when they have to give up things that make them, they have to give up some of their independence when speaking of driving, especially when it's due to cataracts, they have to give up their driving. So sometimes that loss of driving it bothers them because that messes with their independence. So when we're talking to them, make sure we're talking to them about the feelings related to things as such, of them losing their independence, like driving and getting around. I want you to look up Plavix and know that it does increase bleeding. It is an antiplatelet aggregate. I need you to understand that and really understand that medication, because if you have any patient that's going to have surgery, eye surgery, ear surgery, bowel surgery, and they haven't stopped taking that medication prior to surgery, you make sure you notify your doctor immediately. Make sure you focus on the area concerning glaucoma, because glaucoma is caused when the intraocular pressure becomes too high and stays high long enough to cause tissue ischemia and death. Then at that point, vision loss is permanent, unfortunately. But please don't let anyone come to you or you correct them and tell you that glaucoma is an infection. It is not. In previous slides, we went over the pressures for glaucoma, or pressure in the eye, normal pressures. So if you have a patient that has increased intraocular pressure, which basically is going to indicate glaucoma, make sure you start teaching the patient about drugs for a glaucoma. Very important. When the chapter talks about retinal detachment, as a nurse, I need to make sure that we teach the patient and that we reinforce the patient about avoid reading, writing, and close work, because they all cause rapid eye movement, and you don't want that after a retinal detachment surgery. Your book also talks about retinitis pigmentosa. They may abbreviate it RP. Just know that with that diagnosis and with cataracts, different patients, patient can have that, or a patient can have cataracts, sunglasses are still needed. Don't let them say, oh, I don't need to take my glasses. They still need sunglasses. When you receive a patient as an admit and they're considered nearsighted or near blind, I apologize, make sure you have, or describe to them focal points in a room to help him or her get around. Please remember your drugs and your families of drugs. So if one drug is related to another drug in the family, if a patient has an allergy, they can possibly be related to that drug, like your Olos and your Onamides and different ones that ends with the same ending. Double check and make sure the patient does not, double check with your doctor to make sure the patient doesn't have an allergic reaction, or allergic reaction could occur, so you double check with your doctor. Make sure the ending of the drugs, if they sound alike and they spell alike, the ending, they're probably more than likely allergic to that drug if they're allergic to the same drug in that family. In addition to that, if anything is going on with your patients, anything critical, emergent, always remember that the airway comes first. We go back to our ABCs. Just a small talk on cataract surgery. Remind your patients that if their vision gets worse after cataract surgery, more than likely an infection is going on. Not a complication of the surgery, but an infection is happening, and we need to notify the doctor. Now let's talk about bacterial conjunctivitis. Now we know that it's very contagious. Reinfection or cross-contamination between the patient's eyes for sure is possible. The patient should discard all eye makeup being used at the time the infection started. Please remind patients to that. And then when it's still in eye drops, the patient must be careful not to contaminate the bottle by touching the tip to the eye to the face. And the patient should be instructed not to share towels. I think that's about it, but I wanted to make sure I reinforced on that. Also, make sure that the contact lenses are discarded also. Please don't forget how to instill your eye ointments. So the patient should be instructed to look up while gently pulling the lower eyelid down. Okay? Quick for the ears. Make sure patients should be taught not to put anything larger than a fingertip into their ears, even using a cotton swab, because even though it's soft, it can cause damage to the ears and serum buildup. For the ear, make sure you understand that sensory neural hearing loss can occur from damage to the cochlea, the 8th cranial nerve, or the brain. Serum buildup also can decrease hearing in older adults. I wanted to make sure I touched on that. I will continue on with part 2. So